Thank you for joining us today for this Medicare webinar series and today's topic, Medicare, Medicaid, and other health insurance options, presented by the Pikes Peak Area Agency on Aging. We would like to thank the Pikes Peak Library District for its support of this webinar series. Before we begin, we ask that you please mute your microphones until we reach the question and answer portions of the presentation. You can also use the raise hand function or the chat area to let us know if you have a question. And now it's my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging.
Thank you, Jared. So good evening, everyone, and thank you for joining us for our last presentation of this series, part 4 of our 4-part series. As Jared mentioned, we're going to be talking about Medicare and other health insurance options that might be available to you. As he mentioned, I will pause throughout the presentation to see if there are any questions. If you have questions, you're welcome to unmute when I pause for questions and simply ask your question. You're welcome to raise your hand with the raise hand function, or you can type a question into the chat at any time and I will address them when I pause for questions. Hopefully everybody got the email that I sent that included the handouts and a copy of the slides for tonight's presentation. If you did not get that information, please let us know and we'll make sure that you get it. And I think that's it. So let's get started. As always, I'm going to introduce who I work with. I am with the Pikes Peak Area Agency on Aging, that works with our member counties, which are the El Paso, Park, and Teller counties, to coordinate and develop systems and programs that allow people to stay in the community and in their homes for as long as possible. Oops. I am the SHIP coordinator. SHIP stands for State Health Insurance Assistance Program, which is a federally funded program that provides unbiased information and education on all things Medicare. The SHIP office here in Colorado Springs serves a total of 9 counties in Colorado. Every county in every state has access to a SHIP counselor, if nothing else by a toll-free statewide number. I've listed both our local Colorado Springs number as well as our statewide number here in Colorado. Quick review of the topics we've discussed so far. Week 1, we talked about Medicare Parts A and B, also known as Original Medicare. We talked about eligibility, enrollment, benefits, and costs. Week 2, we talked about Medicare supplements, also known as Medigap, and Medicare Advantage plans in detail. And last week, we talked about the newest benefit of Medicare, Medicare Part D, D for drugs, and how that benefit works. And tonight, we are going to talk about pretty much all other types of insurance that might be available to someone who is becoming eligible for Medicare, including employment coverage, retiree coverage, military coverage, Medicaid, and the marketplace. And we are going to start with employer coverage. So many people these days are working past age 65, which again is your initial age of eligibility into Medicare. But a lot of people are going to continue to work, have gainful employment, and that work typically does include a health benefit from the employer. As I mentioned multiple times in week 1, if someone is actively employed with an employer that has 20 or more employees, and they have health coverage through that employment that covers themselves and or spouse or dependents, when you become eligible for Medicare at 65 or under other circumstances, you could actually delay your enrollment into all parts of Medicare in favor of that active employment health insurance. It is, again, the only excuse that Social Security will accept for not enrolling in Medicare at first eligibility. So if you delay enrollment into Medicare because you have active employment with health coverage, you can enroll in Medicare anytime after your initial eligibility while you're still employed to be effective whenever you want it to be. Or you get an additional 8-month window from the time the employment ends to enroll in Medicare without penalty. Now, you have several options in that situation. You can choose to enroll in no part of Medicare in favor of the employer coverage. A lot of people will also choose to enroll in just Medicare Part A if they are entitled to Part A at no cost. And if you went that route, you would still have any time while you're employed to enroll in Part B, or up to 8 months after employment ends to enroll in Part B without penalty. Or you can enroll in both A and B of Medicare. In that scenario, your employer insurance would still be your primary coverage and Medicare would be secondary. There could be some benefit to doing it that way if your employer coverage, for example, has a high deductible. If Medicare A and B were secondary to a high deductible employer plan where you don't have a health savings account to supplement that high deductible, any claims for any services that you receive under that employer coverage could be submitted to Medicare as a secondary benefit. And Medicare would apply their regular payment schedule. So for example, for hospitalization, if you have a $10,000 deductible on your employer policy, so you have a hospitalization, the employer policy applies that whole $10,000 to your deductible. You could submit that balance to Medicare, and Medicare would apply their regular formula for hospitalization and probably pay everything except for their deductible of $1,600. Would be the same scenario for Part B services or outpatient services. On the other hand, you would also have to weigh the fact that you would be paying premiums for both insurances. So if you have both A and B, you would be paying the Part B premium in addition to the employer plan premium. So again, there could be some situations where that might be advantageous. It would be something you would definitely have to look at very carefully. Also keep in mind that employers cannot require someone who is becoming eligible for Medicare to enroll in Medicare. It is actually against the law for them to do that. Neither can they entice you to enroll in Medicare, incentivize you to enroll in Medicare, or to encourage you to enroll in Medicare for any reason. If you are actively employed with employer group coverage, the fact that you become eligible for Medicare should have no bearing whatsoever on your status with the employer health benefits. For people who do continue to work, you may find yourself in a situation where perhaps you're approaching Medicare eligibility at 65, but not yet reached age 65, and employment ends prior to turning 65. In that situation, and pretty much in all covered situations, you would have the option of choosing COBRA coverage. COBRA coverage, which stands for Consolidated Omnibus Budget Reconciliation Act coverage, is also known as continuation coverage. And it is a health insurance benefit that is designed to allow you to continue your employer group health coverage even after employment ends. This has been an important stopgap so that people can remain insured even after they stop working or lose eligibility for the employer coverage. Between that stopping work and maybe Medicare eligibility or the ability to get other coverage. So it's kind of a stopgap. It's temporary. It usually maxes out at 18 months worth of coverage to be eligible. And all employers are typically required to offer this when your employment ends, or you have a reduction in hours that causes you to lose eligibility for the health benefit through the employer. And again, it continues your employer coverage even though you're no longer employed with that employer. On the downside, you do have to pay the full monthly premium for that COBRA coverage if you choose to use it, or if you have to use it for whatever reason. It is also extended to your dependent or spouse. In that situation where you have employer coverage covering a dependent or a spouse, you lose that employment, you can use the COBRA coverage to cover your dependents and spouse. And the dependents and spouse may also be able to extend that coverage without you if you become entitled to Medicare. If for some reason you have divorce or legal separation, you pass away, or one of your dependents loses their dependent status because they've aged out of it. COBRA coverage would be extended to the spouse or dependents in those situations, even if you're no longer covered under the COBRA coverage. If you have COBRA coverage, if you have enrolled in COBRA coverage because you have lost employment or eligibility for the employer health benefit, when you become eligible for Medicare, that can affect your eligibility for COBRA. There are basically two ways that can go. If you were actively employed and you became eligible for Medicare and you were entitled to Medicare before you lost employment and you took COBRA, you would be able to do that because you were entitled to Medicare prior to getting onto COBRA. You would be able to have both. Would it be advantageous to have both? Not necessarily, because COBRA, again, you're paying the full monthly premium for that insurance, and it can be quite expensive. So it may not be advantageous for you to do that. If you're in a situation where you would need to have that coverage for your spouse or dependents, it would still be probably more financially advantageous for you to enroll in Medicare and keep your spouse and dependents on the COBRA. If you lose employment or lose eligibility for employer coverage, you go on COBRA as a stopgap until you become eligible for Medicare. Keep in mind that even though you can enroll in COBRA instead of Medicare, it's probably not to your advantage to do so. So if you are on COBRA and become eligible for Medicare, you need to enroll in Medicare, because once COBRA finds out that you've even become eligible for Medicare, their benefits will stop. The only time you could keep COBRA and Medicare is if you were eligible for Medicare prior to getting on COBRA. So the bottom line is, it would really be something you'd want to look very hard at. You'd want to compare costs and premiums and deductibles and copays between the two different options. I know a lot of people will fall into a situation where they need to continue that COBRA coverage for a spouse or dependent, but even in that situation, the likelihood of you being better off going with Medicare instead of COBRA is probably still pretty good. But there are a lot of different situations that COBRA can fall under, and the rules can be confusing. I still get confused about them, which is why I don't give you more than those two scenarios. But if you do have questions about COBRA, or you're not sure about a COBRA situation, you're always welcome to reach out to us, and we will be able to help you try and figure out what situation you fall under and what rules govern that benefit. I did include a handout in the email that I sent out earlier today that included like a FAQ page about employer coverage and COBRA that you might find useful. But again, if you have additional questions, you're always welcome to reach out to us, and we're happy to sit down and talk to you about those options. Any questions about COBRA or employer coverage? All right, I don't see any questions. I don't hear any questions, so we will move on to retiree coverage. So if you are fortunate enough to have worked for an employer that offers health benefits at retirement, and you are eligible for those benefits, I always encourage people to look at those benefits pretty closely. Oftentimes, if an employer is offering health benefits for their retirees, those benefits are typically going to be pretty decent. But the caveat to that is that retiree health benefits offered through employers, private employers, can have a huge wide range of options. Employers are actually allowed to customize health benefits for their retirees in almost infinite ways. They can take standard health insurance options, especially for people who are becoming eligible for Medicare, they're retirees who become eligible for Medicare. They can take standardized health insurance options and customize them. So when I said in week 2 that Medigap options are set in stone, that does not apply to employer retirement health benefits if they're offered to you. Employers can take a standardized Medicare supplement and alter it because it's an employer benefit. But there are, again, a lot of different ways employers can offer health benefits to their retirees. Some of the most common options for benefits offerings would include an employer offering their retirees just standardized supplements and standardized Advantage plans and Part D plans, but they offer them through a third-party entity that kind of acts like a brokerage. Oftentimes in a situation where an employer has simply handed off that task to a third-party entity to, advise people, their retirees, on what benefits are available and how they work and what they cost. Again, that's typically going to be more of a brokerage where they're going to sell you or offer you a limited number of those options. They're going to be standardized like we talked about in week 2, but they may not offer you every benefit or every offering from every company through those brokerages. Oftentimes when an employer uses that option, they will provide a subsidy or some sort of financial benefit that helps you pay for those offerings, or it provides a discount on those premiums if you go through that third-party brokerage of some sort, or they can simply provide a stipend of some sort where they'll pay a part of that premium and you pay the rest. Other types of retirement health benefits that I've seen employers offer will be Advantage plans that have been customized to the employer's preferences. So for example, PERA, Public Employees Retirement Association, PERA retirees are offered Advantage plans for those that have Medicare. They offer a standard Advantage plan with Kaiser, just a regular old-fashioned Kaiser benefit, which is a standard HMO, but they also offer a United Advantage plan, which they call a PPO. However, it doesn't work like a traditional PPO. It actually works more like a Medicare supplement. And because it's an employer benefit, PERA can make that happen. Or it can be a combination of some of those things. Most of the time, if you're offered a retirement benefit, is usually worth looking at. I have rarely seen health benefits offered to retirees with Medicare that aren't worth considering. I've seen them, but it's not been very common where they're not worth looking at. So I always encourage people to get information about what health benefits are being offered so that you can compare the cost of those benefits and the premiums and the copays and all of those kinds of things to what you might be able to get on your own as a standardized Medicare or Advantage plan. A lot of times you're also going to want to need to know whether or not the benefit being offered by the employer has creditable drug coverage, meaning is their drug coverage as good as or better than what Part D would offer. Employers, even pre-Medicare, are required at a federal level to provide a written notice every year to all their employees covered under health benefits, a written notice every year that states whether or not the drug benefits offered through the health coverage of the employer are considered credible compared to Medicare Part D. And again, that's a federal mandate that all employers must send that notice, even to employees that have no eligibility into Medicare. So you should be able to know, but it's always a good idea to ask. If drug coverage is an important benefit for you to have because you already perhaps have high drug costs of some sort, then you definitely want to look at formularies being offered through the employer plan versus what you can get through Medicare Part D or an Advantage plan. So a lot of different things you'd want to take into consideration. But again, we are able to sit down with you if you can get some basic information from your Human Resources Department or your retirement association. We're happy to sit down with you and help you compare apples to oranges. Keep in mind that employer retirement health benefits are optional. And there's always the possibility that if they offer them today, they may not offer them down the road. The benefit of that is if you have that option of an employer health benefit, you use that option, and for some reason down the road, the employer decides to drop that option for their retirees. Medicare has put laws and rules into place that would allow you to be able to get other insurance coverage through either a standardized supplement or a Medicare Advantage plan because you lost that coverage through no fault of your own. So Medicare has rules in place that would hopefully never let you be in a situation where you're uninsured or uninsurable through no fault of your own. So even if you're not 100% sure about the employer option, even if you take advantage of it and it goes away down the road, you'll still be able to get coverage with guarantee issue in that scenario because you lost that coverage through no fault of your own. Again, like I mentioned, you're going to want to compare costs, drug coverage. You may even want to look at availability or ease of use. Is what the employer is offering you an HMO where you're limited to who you can see and where you can go versus if you went with Medicare and a standardized supplement. Those are some of the things that you'd want to take into consideration. I do see a question in the chat. Can you elaborate more on how PERA MA plans with United resemble a supplement? Okay, so for PERA retirees with Medicare, one of two options that they offer is the United Medicare Advantage, PPO. When I say that it works more like a Medicare supplement, what I mean is it is a Medicare Advantage plan. It is a PPO. However, you're not limited to whatever network that Advantage plan offers. You can literally go to any doctor anywhere in this country for any need, as long as that provider takes Medicare and is willing to work with United. And United will pay them as if you have Medicare primary and United is secondary. Now, under the PERA options, they offer two levels of that United coverage. If you're willing to pay a slightly higher premium, your United PPO coverage has almost zero copay, no out-of-pocket costs. Very few services would have an out-of-pocket cost. If you go with the lower premium United option, there are out-of-pocket costs in the form of copays for every service. So if you go with the United PPO with PERA that has the higher premium, you would have almost no out-of-pocket costs no matter who you saw or where you saw them or why you saw them. So even though it's a PPO and PPOs can technically let you go out of network, because of the way PERA has structured this PPO, if you have that higher premium PPO with no copays, you're going to be able to go anywhere you want, anywhere in this country, see anybody who takes Medicare, and United will pay them practically 100%. If you have the lower premium PPO that has copays, you may have to still pay those copays, but honestly, those copays are still primarily lower for most services than a PPO that you could go out and get on your own. And the premium is so much lower than the zero copay PPO that you pay almost nothing for it if you have the full subsidy through PERA. PERA also subsidizes the premiums for those Medicare plans, so that if you have 20 plus years paid into PERA, you get $115 off whatever their premiums are. And I think the higher premium PPO is like $150 or so. So just keep in mind that if you have the United PPO with PERA, you still have the freedom to go anywhere you want, see anybody you want. And as long as they're willing to work with United, United will pay them for whatever services you need. So even though it's a PPO, it has much more flexibility than other standard PPOs. If you wanted more detailed information or to talk about it in more depth, I'm happy to do that with you, or any of our counselors would be happy to do that with you. Just give us a call. Okay. Thank you. Any other questions about retiree coverage? Right. So I'm in Colorado Springs, and obviously Colorado Springs is surrounded by a lot of military bases. So we do talk to a lot of military people. We talk to both military retirees as well as just veterans. For military people who are aging into Medicare, if you're a retiree, meaning you have put in your 20 plus years into the military service and have retired with an honorable discharge, you are going to automatically be eligible for TriCare. And when you become eligible for Medicare, you are also automatically eligible for TriCare for Life. TriCare for Life is the benefit that the military offers for people specifically with Medicare. Prior to that, you could still access their regular TriCare benefits, even if you're no longer serving once you're retired. The standard or prime TriCare benefits do have small annual premium, but once you become eligible for Medicare, if you want to retain TriCare coverage of any sort, TriCare typically does require that you enroll in both A and B of Medicare. TriCare has gotten really, really good at making sure that you are aware of what you have to do when you become eligible for Medicare. And the DEERS office, your local DEERS office, will typically send you a postcard or something in the mail up to 3 months prior to turning 65 to let you know, we know you're turning 65 and this is what you have to do if you want to keep TriCare. If you have TriCare Standard or Prime prior to Medicare, as soon as Medicare goes into effect, it automatically turns into TriCare for Life, and TriCare for Life acts like a Medicare supplement, but it pays 100% after Medicare. Pays all your deductibles, pays all your co-insurances, pays everything. TriCare for Life also includes a drug benefit that is considered better than Part D, so it's creditable. So quite frankly, if you are retired military with access to TriCare and TriCare for Life, the combination of Medicare and TriCare for Life is quite frankly probably the best insurance coverage anybody can have in this country today. TriCare for Life does not cost anything. And again, it pays all costs after Medicare. The only thing that is required is you send a copy of your Medicare card to the DEERS office. Now, if you are retired military with your 20 plus years, but you retired and then you went to work in the private sector, and you are still employed when you become eligible for Medicare, you can delay enrollment into Medicare and TriCare because you're actively employed with employer coverage, just like if you didn't have military background. You would be allowed to delay enrollment into Medicare in favor of that employer coverage. When that coverage ends, you'd still have the same time frames to enroll in Medicare. And then once you're enrolled in Medicare, you could go back to TriCare and TriCare for Life. Keep in mind, though, that in that scenario, you would not want to take advantage of that 8-month window after employment ends, because you need to enroll in Medicare as soon as you lose that employer coverage in order to maintain the TriCare for Life. But that is really the only caveat to that. So you can delay enrollment into Medicare and TriCare if you're actively employed. And as soon as that employment ends, you enroll in Medicare, send a copy of your card to DEERS, and you automatically have Medicare and TriCare for Life. And again, that is wonderful, wonderful coverage that you have earned. If you want more information about those benefits, I've included the TriCare website at the bottom of the screen, and it actually has some pretty comprehensive information about how Medicare and TriCare coordinate. If, on the other hand, you're not a retiree, but you are a veteran, and you access the VA system for your health care, which we do also have a lot of veterans in this area and throughout the state that use the VA medical facilities and services. To be eligible to use the VA medical facilities and services, that eligibility can be determined based on whether or not you have a disability of some sort. It could be based on income. It could be based on other needs. If you are approved for use of the VA medical facilities or services, and that's what you use as your primary care, that's great. It doesn't probably cost you a whole lot, if anything. But when you become eligible for Medicare, and I get this question a lot of people want to know, do they have to enroll in Medicare, or should they enroll in Medicare if they get everything they need through the VA? And my answer is always maybe or probably. Again, there is nothing that says you are required to enroll in any part of Medicare. It is absolutely voluntary. The VA medical system is not considered health coverage. It's not insurance. It's a system. And it's also not considered employment. If you choose not to enroll in Medicare Part B because you have a premium and because you use the VA system for all your needs, you can choose to do that. However, if for any reason down the road you decide that having Medicare Part B would be to your advantage, keep in mind that you will be limited to enrolling in Part B to the general enrollment period each year, and you will pay penalties for late enrollment because using VA in favor of enrolling Medicare is not considered an acceptable reason not to enroll in Medicare. There are a lot of advantages to having access to both the VA system and having Medicare. In Colorado Springs or in El Paso County, we have a lot of medical facilities for military personnel or veterans. However, that does not necessarily mean you will always be in a situation where you have access to that care when you need it. If you have Medicare in addition to using the VA system, Medicare provides you access to medical care anywhere, anytime, for any reason. That is one of the biggest benefits. If you access the VA system for your health care, you have access to all of their services for, say, long-term care services and supports. So you have access to VA living facilities and long-term care, home and community-based services to get care at home, in addition to whatever health benefits that you might be using through the system. But again, you may not always be in a situation where those are easily accessible. And quite frankly, until recently, Colorado Springs, even with all the military bases we're surrounded by, did not actually have a VA medical facility. You had to go to Denver. Luckily, we finally got a VA medical facility, and that has been great. But again, that does not mean you'll always be in a situation where that is convenient. So having Medicare does have has its advantages. But on the downside, you do have to pay the premium. But I think in many cases, if that's something you can afford to do, it outweighs the downside because it gives you the freedom to get what you need when you need it, whenever you need it. I think that's all I have to say about VA. Any questions about being retired military or a veteran and your benefit options? All right. Don't see any questions, don't hear any questions. So we will move on to Medicaid. So Medicaid is going through some changes right now based on the ending or the upcoming ending of the COVID pandemic or the public health emergency. Because Medicaid was expanded many years ago, 2014, under the Affordable Care Act, many people had become eligible for health benefits under Medicaid that hadn't been able to be eligible prior to the Affordable Care Act and the expansion of those benefits. So a lot more people were able to qualify for Medicaid and be assured health coverage under Medicaid benefits, the expanded Medicaid benefits. Medicaid is a state-run health program. It's funded federally and by state dollars, but it is a state-by-state program. And in many cases, it is a county by county program, because if you move from one county to another, you have to reapply for Medicaid when you get to the other county. Medicaid program in Colorado is called Health First Colorado. Professionals tend to refer to it as Magi Medicaid, which is Medicaid health benefits for people, for pretty much anybody, based on income only, for anybody who's between, say, 18 and 64. And it provides full medical coverage, including prescriptions. What a lot of people don't realize about Medicaid is that there are lots of different kinds of Medicaid. Magi Medicaid, or modified adjusted gross income Medicaid, expanded Medicaid, is only one of about 45 different kinds of Medicaid in the state of Colorado. Each one of those types of Medicaid does have different eligibility criteria based on income eligibility, and in some cases, physical need or medical eligibility. When Medicaid is an option or something that you are enrolled in, and you have other insurance options that you are also eligible and enrolled in, keep in mind that Medicaid is always going to be the payer of last resort. So if you have Medicare and Medicaid, Medicare is always primary, Medicaid is always last. But again, there are lots and lots of different kinds of Medicaid. There are Medicaid programs that technically aren't Medicaid, but there are programs that are specifically for people with Medicare. There are programs that are specifically for people who live in nursing facilities. There are programs specifically for people who are extra low income. So there are lots and lots of different kinds of Medicaid. I've already talked about several times the Medicare savings programs, which again is technically not Medicaid. It's a federal benefit for financial assistance with Medicare costs only. But to apply for that assistance, you do a Medicaid application in your county. So it's just easier to call it Medicaid. Other Medicaid programs that people who are 60 and older might be eligible for. There's the OAP program, or old age pension, which is a cash assistance program that if you qualify for, comes automatically with full Medicaid. The long-term care programs that I mentioned for nursing home care, or even assisted living, or to receive care at home so that you can remain in your home, is another Medicaid program. Each one of these programs have different income eligibility criteria, and the long-term care programs specifically have medical need criteria as well. For people who have been on Medicaid simply because they had no other health insurance options and they qualified for the expanded Medicaid or Obamacare Medicaid, if you were enrolled in that Medicaid program prior to the public health emergency or COVID-19, you were allowed to stay on that Medicaid program through the entire public health emergency, which again is ending here in the next month or so, even if you became eligible for other options or somehow no longer became eligible for Medicaid based on, say, an increase in your income. Because of the public health emergency, everybody was kept on Medicaid to ensure that everybody had medical coverage of some sort. So beneficiaries who were on Medicaid and became eligible for Medicare during the pandemic, age 65, were allowed to stay on that Medicaid program, even though once you become eligible for Medicare, technically you're no longer eligible for that regular Medicaid program. But you were kept on it because of the pandemic, which was great. You still should have enrolled in Medicare once you became eligible, but a lot of people did not. Which, who can blame them? Why get Medicare that you have to pay for when you are going to be able to stay on Medicaid that you don't pay for? Unfortunately, once the pandemic ends, that is going to create some situations where people should have enrolled in Medicare a year ago or a year and a half ago, and they didn't. And once Medicaid ends and the system decides that without the pandemic, you're no longer eligible for those Medicaid benefits for whatever reason, then you're going to need to enroll in Medicare. And typically what would happen is you would have to wait until the next general enrollment period to enroll in Medicare, and you could be looking at paying penalties for late enrollment because you didn't enroll when you first became eligible. Medicaid is typically not going to be one of those situations that allows you to enroll in Medicare without penalty. But because so many people fell into this situation, and this is why I'm explaining it, so many people fell into that situation that the government has made an exception to that rule, specifically for people who were unable or did not enroll in Medicare based on the public health emergency and the continuing Medicaid benefits that they were given. So if you or anybody you know falls into that category, all we're encouraging people to do is keep an eye in the mailbox for any paperwork that you may receive from the state of Colorado that it is advising people of their options and what they're going to be required to do and what timeframes they're going to have to do it in. Medicaid is going to slowly, they're not going to dump everyone at once. They're going to wait until someone's next redetermination date or annual redetermination date before they review eligibility again. But if someone is determined to no longer be eligible for Medicaid, you will be dropped from that program and you will have to look at what other options are available. If you were unable or did not enroll in Medicare, but are eligible to do so, you will be able to do so without penalty. We are always happy to talk to people in that situation. We're happy to answer questions for anybody who has questions or is not quite sure what's going on or what they have to do. So again, if you or anybody you know may fall into that scenario, you're always welcome to reach out to us. We've been keeping pace with the state in the state offices about what they're doing in that regard so that we can help advise people what needs to happen next for them. But again, once you become eligible for Medicare, keep in mind that if you have lower or limited income, you definitely want to look at your eligibility for that Medicare savings program or the extra help assistance for your drug coverage with Medicare. Again, I included a handout that kind of gives you a general overview of the income and asset limits for those programs for assistance. And we do help with those applications. So if anybody wants more information or would like to sit down and talk to us or get help with an application, simply give us a call. We're happy to help. Any questions about any of that? All right. So we are almost done. Last thing we're going to talk about is Medicare or the marketplace, or this is the expanded or Affordable Care Act health benefit. Again, Obamacare is what it used to be referred to. It is the federal mandate that says that insurers must be required to sell insurance to people on the open private market, regardless of pre-existing health issues. So this allowed millions of more people to be able to get health insurance, even if they had pre-existing health issues. For most states or most of the country, that federal mandate is managed by the federal government in each state. Colorado opted to manage our own marketplace coverage. And so we have our own system for offering that kind of insurance to people who, and this is insurance for people who may not be eligible or have the ability to get employer coverage, may not qualify for Medicaid coverage for some reason, or may have a pre-existing health issue. This is where people can go to get that health coverage that they need. In Colorado, we call our marketplace Connect for Health. You can go to the website connectforhealthco.com. Basically, that website provides almost kind of the same search engine capability that the Medicare website does that we talked about last week, where it gives you the ability to kind of compare all of the marketplace options and look at the prices and the copays and the deductibles and all of that. It also allows you to see if you are eligible for tax credits or premium subsidies so that you can reduce what you would pay for that kind of coverage. So again, it's going to be an option for people who in the past did not have that option, especially if they had pre-existing health issues. There are limited times when you can enroll in this kind of coverage. It has annual enrollment periods, but there is also special enrollment opportunities for people who've fallen into specific situations, such as loss of other creditable coverage, like employer coverage. You would have the ability to get into a marketplace plan if you needed to, within a certain window of losing other creditable coverage. For people who are becoming eligible for Medicare, if you have been enrolled in a marketplace benefit because that was your best option at the time, and you become eligible for Medicare, keep in mind that you need to enroll in Medicare. Typically, it's not encouraged, and it's really not financially viable to have both Medicare and Marketplace. And really the only time you'd be allowed to have Marketplace instead of Medicare is in a situation where you don't qualify for free Part A of Medicare. So if you don't have enough work history to get Part A at no cost, you would have to pay to have that benefit. You could opt to get Marketplace coverage instead of having to pay a premium for Part A and Part B. If you have premium-free Part A and you have a Marketplace plan, you become eligible for Medicare, you get premium-free Part A. Theoretically, you could stay in the Marketplace and have Part A, but if you were getting any premium subsidies or tax credits, those would go away. And if you are already enrolled in free Part A and someone tries to sell you a Marketplace plan instead of enrolling in B or getting other coverage that goes with Medicare, that is actually illegal. So if someone knows you have Medicare, they should not be enrolling you in a Marketplace plan or encouraging you to enroll in a Marketplace plan. If you opt to keep your Marketplace plan instead of enrolling in Medicare, keep in mind that eventually the Marketplace will probably find out that you were eligible for Medicare at some point, and they will drop you. And then you'll have to scramble to enroll in Medicare. Marketplace coverage is not considered a good excuse for not enrolling when you first became eligible. So you're looking at having to wait for the next enrollment period and paying late penalties for not enrolling when you should have. So it does not waive any of those penalties. So the bottom line is it's not usually a good idea to try and have Marketplace coverage instead of Medicare, or to have Marketplace coverage and Medicare. They also will not coordinate with each other. So one's not going to be primary, the other's secondary. Marketplace is going to pay their part, and if they find out you have Medicare, they're going to stop paying anything. Except for in that scenario where you have to pay for Part A. On the other hand, if you have Medicare, you could go to the Marketplace to look at dental insurance if that's something you are interested in having. So the Marketplace does offer that same kind of comparison where you can compare dental policies or dental vision policies side by side and compare costs and coverage. And because Medicare does not cover dental at this point, it is not a benefit of Medicare, you can purchase or get whatever kind of dental benefit you want in any way you want. And this would simply be one option to look at if that's something that you feel you want and pay for or have. So you can compare dental options through the Marketplace, but again, Medicare and Marketplace do not mix, and you probably shouldn't have both, or you shouldn't use one instead of the other. Those rules can be kind of confusing as well. I included a handout with the email that I sent you earlier today. That's kind of an FAQ kind of handout. If you did have other questions, feel free to give us a call. We're happy to talk to you about your situation. And I think that is all I have for you. Are there any last minute questions before I wrap it up? All right, not seeing any, not hearing any. As always, I so appreciate you guys attending these presentations. I hope you found them useful and informative. We appreciate you hanging in there for 4 weeks. I know it was a lot of information to cover. Hopefully it was useful. As always, if you have questions or you would like to sit down and talk to us one-on-one, always welcome to reach out to us. We're happy to talk to you. You can call us at our local Colorado Springs number. You can call us through the toll-free statewide number. And I think that is it. So I will let you go with that. Hopefully we'll see you if you do have any questions or concerns, or if we can be of assistance during the upcoming open enrollment period in the fall. Otherwise, I wish you guys a good evening. I hope you enjoy your summer. And again, thank you for attending these presentations. Always welcome to check our website for any future presentations we may be offering on different topics. And if you have any suggestions for future topics, we're always open to hearing those suggestions as well. With that, I'll bid you good night and thank you again.